Yesterday was a relatively slow day when you look at what we've been the last couple of months at Miller Park. We had 1,384 people tested there. On the northwest side at the Northwest Health Center, we had 425 individuals who were tested. And at the South Side Health Center, we had 300. So that brings our total for the week to a little over 2,100. And I start with those numbers as I do whenever I speak on this press conference call. But as I've been saying for some time now, we have seen a steady decrease in our community testing numbers. And this is something that is of concern. I actively encourage our residents to take advantage of free COVID-19 testing at one of our 3 community testing sites. The lines aren't as long as they were when we started. The turnaround time is relatively fast. And it's probably more important than ever, particularly during this period, post-Thanksgiving, pre-Christmas, Hanukkah, Kwanzaa, that people are monitoring this. So following holiday gatherings, testing is more important than ever to ensure that you, as well as your loved ones, are staying well. And we're seeing these numbers exploding around the country right now. And I don't want to see another surge happening here in the state of Wisconsin. Our numbers have been coming down to some extent over the last several weeks over where they were in October and early November. But again, we've seen the wave-like surges around the nation. And although we are not experiencing one of those wave-like surges right now, that could happen. What we don't know is whether we're past the surge that's occurring in other parts of the country or whether we're ahead of the surge that's occurring in other parts of the country. But our efforts to address the pandemic have been and will continue to rely on science and real-time data. We need to keep measuring the spread of COVID-19 in our community, which means we need people to continue to be tested. It's very important that we get our testing numbers back to where they need to be. Right now in Washington, we know there's a lot of conversation that's going on about another stimulus package, another relief package. But I want to give you an update on one of the programs that we still have dollars from for the initial CARES Act dollars. As I pointed out previously, we're in the midst of more than a public health crisis. We are also facing an enormous economic crisis. Bars, restaurants, small businesses, childcare facilities, a lot of small entrepreneurs in particular have been adversely affected. We've now gone through 2 rounds of our Restart Grant program that help local businesses mitigate the impact of COVID-19. And as you may recall, this Restart Grant is geared toward smaller businesses because we felt that in the first package that Congress passed, that a lot of the aid that it was directing was going to larger businesses. And we're very, very concerned about the impact of this on main streets, on street corners, on businesses, even out of homes that are here in the city of Milwaukee. So this program, this Restart program, was designed so that our small local businesses, who are employers all across the city, could help weather this pandemic. The Restart program has made very good progress in helping businesses purchase social distancing modifications, personal protective equipment, and also to winterize outdoor spaces, which will continue to be a challenge as we get even closer to the real winter months here. I am not unhappy that we have not had any snow at this point, but I know it's coming. It's just a matter of time is when it gets here. But we still have remaining CARES Act dollars that we will distribute to Restart program participants, but they are for those who have already completed the application process. So this is not a new round for new applicants. This is for those participants who've already completed the application process. We will also be allocating additional CARES Act dollars to businesses and organizations fighting COVID-19 and addressing the needs of vulnerable people. And again, as we get into the homeless situation, as we get into the warming centers, this all is very, very real. And it's something that we're very, very attuned to here at the City of Milwaukee. Finally, I would like to provide you with just a little information more about the COVID-19 vaccines. You'll hear a lot more from our medical experts, and we're waiting and working with the state to get even more information. But I think as many of you know, the Pfizer vaccine was approved for emergency use last week and is now being distributed. The Moderna vaccine will be reviewed for emergency use this week. Thursday or Friday, I believe, is the date that we are hoping to see an approval of that. So health systems around the community are beginning to receive the first distribution of the Pfizer vaccine. And not surprisingly and appropriately, healthcare providers have been prioritized to receive vaccines in this very first distribution. These are the individuals who are interacting with patients, and it makes sense for them to receive it first. So